As the United States battles the coronavirus, one thing has become increasingly clear. We were not prepared for this.
I am dreading the day when we run out of masks. It's like going into battle without even a fighting chance.
We get one N95 mask apiece, and we had one gown left. I don't know how we're going to protect ourselves, how we're going to protect our patients.
We're having to pick and choose who to test.
My colleagues who are physicians, and they're talking right now about a backup plan for their newborn son if they both get infected at the hospital.
As you just heard from those in the trenches, we're short on masks, we're short on ventilators, we're short on personal protective equipment, and we're short on tests. According to projections from the American Hospital Association and the Department of Health and Human Services, the United States is short 760,000 ventilators and 280 million masks.
Here's my question. Where are they? Where are the ventilators? Where are the gowns? Where's the PPEs? Where are the masks? Where are they?
I stand here as someone who has had confirmed orders for millions of pieces of gear evaporate in front of us. And I can't tell you how frustrating it is.
I think the slightly sketchy middleman is the understatement of the year. It's the Wild West. There's no replacing the federal government, and we need them in a big way right now.
But here's the thing. We can start fixing this right now if we try, or rather, he can.
I used to be a Defense Department official, and we talk about defending the homeland quite a bit. This is sort of the precise meaning of it. This is defending the homeland. And unfortunately, this enemy happens to be a virus, right? And it's going to require a significant federal national response, leveraging our industry, leveraging our national security institutions, leveraging our medical expertise and scientific community. This is basically a mobilization, a national mobilization to deal with the threat. Then the threat just happens to be a virus.
I would say my life as a congresswoman has pretty fundamentally changed in the past 2.5 or 3 weeks now. I'm Alyssa Slotkin, congresswoman for Michigan's 8th district. I would say I've taken up a weird role, as many members of Congress have, of just being sort of a matchmaker. The companies who say, I can get you 3 million masks, and then connecting them to the right senior people at the state or at the hospitals to actually procure that equipment. We just have major gaps, as many states do.
To fill the gaps frontline care workers are facing, we will need to ramp up production of ventilators and personal protective equipment, and we will need to do it fast. That's where the Defense Production Act comes in.
And so the Congress passed the Defense Production Act of 1950, and it was signed by the President.
I've directed the agencies to exercise these production powers vigorously and promptly, making use of every resource of American business, large and small.
So the Defense Production Act was signed into law in 1950 at the height of the Korean War, and it really was meant as a war mobilization effort. So essentially, it gives the president the power to harness and leverage our domestic industry in the name of national defense.
Under the Defense Production Act, the president can issue orders through FEMA to demand American manufacturers like General Electric, Ford, GM convert their factories to produce the equipment we desperately need. The DPA allows our government to provide the resources, purchase orders, and money these companies need to get the job done. And that's an important piece of this. Even companies that want to help need the startup resources to make enough PPE and ventilators and to get them where they need to go.
We need the Defense Production Act to be implemented. And what that means is, most importantly, for the companies that have already moved out, that didn't wait for direction, that just have moved, they need guaranteed orders. They need the contracts inked with the federal government to order massive quantities of, let's say, ventilators, because they need to know if they're retooling and they're trying to get preferential treatment from all their suppliers, they need to know that those orders are there. It's almost 400 parts in a ventilator. So we need to make sure that those smaller suppliers bump the ventilator requests up to the top, and they need top cover to do that. And that top cover comes from the federal government.
Using the Defense Production Act wouldn't even be new for the Trump administration. According to the New York Times, the Department of Defense used it to obtain rare earth metals needed to build lasers, jet engines, and armored vehicles as recently as last summer. In fact, the Defense Department estimates that it has used the law's powers 300,000 times a year. But in this massive crisis, where thousands of Americans are dying, Trump has only used it twice.
I certainly think that we lost valuable time in the last 6 to 8 weeks, where I think the federal government should have been doing much more proactively. You see folks on the front lines putting, plastic trash bags on themselves because they have shortages of gowns. So there's really, the frontline medical workers are really facing profound shortages, and I really worry that we are really behind the 8 ball.
The sheer magnitude of this crisis has only just begun to hit our care providers, and it's growing every day, which makes this administration's refusal to use the DPA even more devastating.
I did something I never thought I'd do, which is I actually co-authored a piece of legislation that forces the executive branch to use their powers under the DPA. As someone who was in the Pentagon and the CIA and managed a lot of crises, there would be almost nothing that would get me to write a law that would have the legislative branch forcing the executive branch to run a crisis a certain way. But it was just out of the sheer desperation from my district. The truth is, we should have been moving out much more quickly in January when we saw that this was breaking out in China. When we saw it moving to Italy, we should have been amassing supplies then, and we should have been having those conversations with our manufacturing base through the DPA to say, hey, Ford, hey, GM, think about this. What would it take? Start scoping it.
It's a number of people have said it, and I feel it, actually. I'm a wartime president. This is a war.
The president likes to talk about being a wartime president, but he's not actually acting like a wartime president with respect to this pandemic.
The thing that we've been very open about in Michigan, now that we have the third highest number of cases behind New York and New Jersey, is there is a gap. And we need to do what our community is used to doing in a crisis, which is cover those gaps with creativity, with new thinking, and with local manufacturers who are converting in real time. That's just the reality of where we are. And while the DPA, the executive branch, is now negotiating those very contracts that we need to see, I hope that they do that. But beyond that, we're going to need as a country to understand that this is not a moment of just lobbying. This is a moment of rolling up your sleeves and doing more than you've probably done in a long time to help your local community.